Dr. Crystal Lemmons needs no introduction at Missouri Southern State University. Dr. Lemmons is the Dean of the College of Health, Life Sciences, and Education right here. She brings more than 2 decades of academic and leadership excellence to this role. Dr. Lemmons joined Missouri Southern in 2000 as an adjunct professor and became an assistant professor of biology the following year. Throughout her career, she has held multiple leadership positions, including department chair of biology and 3 years of service as vice provost. A former practicing veterinarian, Lemmons has taught a wide range of rigorous courses, including human anatomy, radiation biology, pathophysiology, parasitology, histology, and advanced topics in biology such as embryology. Many of her students have gone on to become physicians, researchers, and professionals across the healthcare and science fields. As Dean, Dr. Lemmons leads a college that encompasses allied health, healthcare administration, biology and environmental health, kinesiology, nursing, psychology, and teacher education. She brings to the role a deep understanding of this university, a strong focus on student success, and a vision aligned with the continued growth of Missouri Southern's health and life sciences initiatives. Please join me in welcoming Missouri Southern's very own Dr. Crystal Lemmons.
Thank you so much for that introduction, and I just want to thank you all for coming and the sponsors that are involved in this event. It is so important, I think, to our community, to our students, to our area healthcare providers. I'm honored to be here. I'm very thankful to have heard 2 wonderful presentations already. Mine is really going to focus on healthcare education, but I also want to share some neat and interesting things that are taking place at Missouri Southern as part of that. So some of you might recognize that we have recently expanded our statewide mission. We have had a statewide mission of global or international education for many, many years. And obviously we want to keep that. It's an important part of who we are at Missouri Southern. But in 2025, we were able to add to our statewide mission. And we've added immersive learning, and we've also added health and life sciences. And we've done that very strategically in answer to a call from the community in terms of what is needed with workforce development. We're very excited to be able to do that. Again, most of what I'm going to share with you is going to focus on healthcare education, but I do want to highlight immersive learning for just a couple of moments. And it's all connected, right? There's a method to the madness, so to speak. So what is immersive learning at Missouri Southern? If you were to Google immersive learning, you would find lots of different definitions. For example, a common one would be something like immersive learning is learning in a virtual environment, like using virtual reality, for example, or maybe augmented reality. That's not necessarily what it is here. It certainly can be a part of immersive learning. Virtual learning can be part of that, but it's much broader. And so I think it's really important to understand, what do we mean when we say immersive learning? What does that mean for us? And so first of all, we are looking at comprehensive learning. So it's not what I call surface skimming. We tend to deep dive. So more comprehensive learning, and in realistic environments. So real life, mimicking real work environments, for example, or research environments. That is key. It's that immersive part of learning that takes place within an environment that is as real life as it possibly can be. And beyond that, we are requiring students to not only have the comprehension, we're going to be developing our cognitive skills, our procedural skills, asking them to make judgments and decisions. We, of course, like to talk about critical thinking in many different ways, but that is a huge part of what that immersive learning will actually provide, not only as part of the process, but as part of the outcome when we've worked our way through that. I've given some examples here of just different courses that may include immersive learning as a significant component. You'll see that's a long list, right? But there are two on here that I would like you to remember, kind of store away, and it's the bottom two. And that's using simulations and then also virtual environments. So we'll come back to that. One of the things I could not resist, just from a scientific standpoint, I have a deep appreciation, right, background in science. I could not resist going a little deeper into learning, and I want to show you a few things that I think maybe we can connect the dots as we go along the way. So I want to focus on a particular type of learning, and the name for this may seem a little odd. It is brain-based learning. How many of you are familiar that we do have different types of learning? Or you might identify maybe with audio learning or visual learning or kinetic learning, for example, like maybe different modalities that will strengthen abilities, a person's ability to learn. Or we have different levels of learning, you know, and again, thinking about critical thinking as a way to not only comprehend, but then evaluate, be able to make judgments, decisions, be able to predict what an outcome will be, understanding the consequences, and overall applying that learning, you know, different levels of learning. The reason I want to focus on brain-based learning is because this is an approach that is based in neuroscience, and it really focuses on how we are going to best be able to learn information. How can we process it the best? How do we integrate it? Where do we store it, depending on the type of information that we're learning? And how do we retrieve it so that we can apply it, so that we can remember it, right, in a meaningful way? That is brain-based learning. And now we get to tie it and understand that there are certain things that go along with that that are critically important. One is that we also have to take into account the environment, the learning environment. We have to take into account psychological factors that impact our learning, social factors that impact learning. It's all of that together, right? That is brain-based learning. So we have three techniques, three kind of pillars, if you will, of brain-based learning. And let's go ahead and look at those. The first one, and let's do some word association here, orchestrated immersion, right? To have a complex experience, right? So that immersion, again, it's immersive learning, okay? So we have a student that's going to be totally immersed in a realistic environment. That is one of the key pillars for meaningful brain-based learning, all right? The second one is relaxed alertness. What that really means is that we eliminate fear in the classroom or whatever learning environment that we have. That is actually critical. How many of us can readily identify, or we can picture, healthcare workers, healthcare environments may be stressful, to say it in a very minimal way, right? We may be dealing with very stressful situations. We may be dealing with high stakes situations, life and death situations. Those are very stressful situations. But for learning, the very best environment that we can provide is an environment that the learner can be relaxed, yet alert, right? So taking the fear out of that environment, that is going to give us the best chance for the integration of that material, that true learning and retrieval of the material. And then finally, the third one is just the active processing. This is incredibly important, and we're going to see it a little bit later on again in a different way, and especially using simulation. So the active processing means that we have to have time. We have to have time that allows the students to think about the material, to process it, to integrate it on top of other information that they've already learned, to make kind of their own self-reflective evaluation of what it is that they've learned. That is going to be critical. All right? So I couldn't resist, and I want you to think about these terms as we go through: the immersive environment, the time for reflection, or that active processing, and again, that safe environment as we go on. Okay, so now I'm going to switch, and let's talk about a little bit of some of the technology that we have that we're going to focus on today, and part of that is going to be simulation learning. How many of you are familiar with that? I'm just curious, show of hands. Simulation? Yes, yes. So I'm going to focus specifically on health sciences or healthcare simulation learning. There are so many definitions on this one. I've chosen just a couple. The bottom one is a little bit more detailed. This is from the National Council of State Boards of Nursing, but I've highlighted some terms there. So it's an educational process. We're going to have our learning experiences that imitate the working environment. So again, it's a realistic environment. That is going to be simulation. I've also given a much more simplified version of that along the top that essentially echoes that, right? We're going to simulate, we're going to mimic a realistic environment for whatever educational goals that we have, and it's going to be a guided experience for our learning. So one of the things I'd like to discuss a little bit is just the basic components of simulation learning. And again, this can be very complicated, it can be very simple. I'm just kind of putting this together in a simplified way so that we can understand some of the things that are happening here at Missouri Southern when we're looking at new technologies that we're going to be using for healthcare education. So in a simulation, you do need a facilitator. That can be a combination of faculty members, simulation staff, or one or the other. But you've got to have somebody that will be there to initiate the experience or the simulation, somebody that's there to guide the simulation. So that's the facilitators. We would have a pre-briefing, and what that refers to is that we do need to discuss with the student what the goals are for the day, for that learning experience, what the plan is, what procedures might be involved, right? Because we need that. We need to be able to plan and predict that for our students. And then the simulation itself, and then finally a debriefing time period. And the debriefing is really going to match, if we go back to this active processing, this is going to match really the debriefing period that we have for simulation. So the debriefing period is a time where students can do some self-reflection. They can evaluate the simulation and their role, their own performance in it. You know, did I do it well? Where did I mess up? Where do I feel like I'm weak? What do I know that I've already learned and I'm strong there, so I don't need to keep going over that, but I do need to focus over here, right? And so it provides that time for the student to do self-reflection. It can also be a time where we have faculty or staff guided reflection as well. You know, what could we do better as a team if it was a team simulation? You know, what are the things that impacted you the most? What were your thoughts when you were, you know, coming into a simulation of this kind? How did that make you feel? It's evaluating things from multiple aspects, not just the learning the material, but also that, again, psychological, the social impact that we would have within that simulation as well. That feedback is critical. In fact, there's a lot of evidence. The research says that the debriefing is actually the most critical component of the simulation. And the nice thing about that is that students get immediate feedback. We would hold a debriefing session immediately after the simulation. One of the things that we see here in this pic is that we have a typical example of simulation learning. This would be for a healthcare setting. We can see a couple of people that are kind of in a different room that's looking through glass and watching students that are in a medical scenario. And so where the two students are that have the computers in front of them, that typically is referred to as the control center, maybe the control core. This is where we have computers that allow us to actually do the simulation. We can make changes. We can kind of control, right? Hence the name Control Center. We can control what is going on in that simulation. The students, and we can see this is obviously a healthcare setting. They're working on a mannequin. They're performing different procedures. There are no instructors in that room. The students have been given the scenario, or they're evaluating the patient to determine what they should be doing. And so then they're making their own clinical judgments, right? They're doing their own assessments. They're executing the procedures that they've learned. They're working as a team. They have to interact appropriately. All of that is being monitored by the facilitators that are in the control center. And so this is a very classic example of what we might think of for simulation in healthcare education. So that leads us to a new term that I want to mention just briefly, and this is fidelity. And so what that means, and again, you'll have more than one definition. I'm just kind of choosing one that I think is most applicable here. It is the level of realism that we have. It's the level of accuracy that we have within the simulation. So how realistic, how real life is the environment? How realistic is the components of the simulation? Not just the environment, but also what about the mannequin that might be used or other aids that might be used, okay? So it is the level of realism. We can think of that as the fidelity. And there's different levels of fidelity, if you want to think of it that way. We can think of that as perhaps on a spectrum where we have low fidelity simulation, we can have like a medium or mid level of simulation, and then we have high fidelity simulation. And so to give examples, a low fidelity simulation would be something that we could use to practice basic skills. And we could repeat that until we felt like we were proficient. So a student might practice, for example, CPR, or they might have what we would call a task trainer, maybe practicing giving injections, or practicing placing an IV, something that's very procedural, very focused, okay? That mannequin or the task trainer that we're using probably isn't going to give us a lot of feedback. It's going to be a very basic type of simulation, okay? So that's low fidelity. If we get a little farther into the spectrum and we have that mid-level fidelity, here we might have to see students that are going to have to do maybe another step or two as part of that procedural process. It may be guided by a facilitator. So for example, and I've got a pictorial here, for that lower fidelity, I've got an example of a student working with a mannequin that is going to give some ventilation, like a mask and bag type of support. So we have to know where we're going to place that, what procedure should we be using for correct placement. That's a basic skill. In the mid-level, if we take that same example, maybe that patient has vomited, or maybe we have an obstructed airway for whatever reason, okay? So either that could be something that the student assesses and discovers on their own, or a facilitator tells them, perhaps an instructor tells them, okay, this patient has vomited, what would be your step now? And so now the student has to think, okay, I've got to do another procedure. I'm going to have to suction out that airway, right, before I can apply any type of bag, mask type ventilation. So that's more mid-level fidelity. And then we get into the world of high fidelity simulation. So high fidelity simulation means that we're going to be using the most realistic environment, the most realistic simulators, the mannequins, for example, that we have. And it's not restricted to mannequins. So we do have what we call high fidelity mannequins that are very lifelike. We're going to get into some features of some of them here in a few slides down the road, but they're very lifelike. They can display physiological functions. You can, for example, listen to heart sounds, lung sounds. Many of them might be able to cry, sweat, grimace, show other facial expressions, have skin color changes, very lifelike type of mannequins. Those are the high fidelity ones. But we may also decide to use a standard patient, meaning that we could use an actor, an actual real-life person, right? Doesn't get any more real life than that, probably. So we could use a standard patient, an actor that is going to exhibit some type of condition, right? Or that's going to be used in that simulation. We can even have standard patients, actors that wear a simulator to mimic a particular condition. So then in that case, not only do you get the actual living individual, but you also have a wearable simulator that's going to allow the student to assess maybe a certain disorder or practice a different procedure. So it's a combination of the two. Okay, does that make sense so far in terms of your high fidelity? An example that I've given is maybe a student walks into that realistic, real-life environment. There is an unconscious, maybe actor or standard patient, or a high-fidelity mannequin that is displaying that unconscious behavior, and that student has to assess the situation fully, looking for contextual clues. What has happened? You know, do we have somebody that is choked? Do we have somebody that's maybe in stroke? And we start doing the assessment. The student has to basically assess the entire situation, perform whatever procedures, or collect whatever data that they feel is appropriate. That's a high fidelity simulation, okay? So obviously there are some things that we want to take into account with fidelity. The type of equipment that we have, that's going to play a huge role. The tasks that we're wanting to accomplish, if it's a basic procedure versus something that is much more complex, what the environment looks like. We know that we have to have a real-life environment as much as possible if we're wanting high-fidelity simulation, but we may not always want that. It may be fine to use a basic classroom and do some low-fidelity simulations depending on what the goals are. And then we also have to consider the psychological, the social implications of working through that simulation. How many of you can picture, and I'm going to pick on the field of nursing. It could be anything in healthcare education, but I'll just use nurses as an example. How many of you can picture you've got a first-year nursing student that is going into a simulation. They are nervous. Their hands might be doing what? Shaking. They may have some sweaty palms. What do you think their heart rate might be doing? Maybe elevated a little bit, blood pressure as well following. They may feel overwhelmed a bit with anxiety, and yet they're going to work their way through this simulation, right? They're going to put themselves in that role of the healthcare professional, and that is part of their education. It's to work through that as much as possible. Are there psychological implications there? Sure. What about working as a team, right? We understand that healthcare, I mean, it's really a team approach, right? Nurses are going to work with respiratory therapists and radiology technologists and physicians and emergency personnel, the paramedics and the EMTs and so forth. So what about working with everybody else on the team that's part of that simulation? And so now we have maybe 3 or 4 students that are exhibiting the same kind of level of anxiety, and we're trying to work and find our way through, okay? So that's what I mean about the psychological, the social implications. We need to think about that as we think about simulation. So, question for you, which is most important, a high-fidelity simulator or a high-fidelity environment? How many of you think A? Just show of hands. Okay, how many of you think B? Yes, absolutely. And it is that. It is the environment. It's the realistic environment. If you look at the 2 pictorials that we have here, on the bottom we have a mannequin, and it may be a high fidelity mannequin, but we're in a classroom situation, okay? So we can use that for a number of different things, but again, the environment is a classroom. If we're thinking about healthcare workers, right, your environment is going to be hospitals, clinics, maybe a home service, a home healthcare worker, you know, any number of different platforms. The top picture, I think we can see that as more of a hospital setting, right? And you've got a team. It's not just a single student. You have a team that's working there. They're having to assess that patient, right, the mannequin. They're working in the team. You can see monitors in the background. We're going to have IV poles, all of those things that really mimic that real life setting as much as possible. And that environment is really the most critical factor by far compared to the high fidelity simulator itself. It's the environment. So think about environment, and that is going to give a nice, hopefully, segue into this, all right? So one of the things that I wanted to mention, some of you might have noticed, or I know some of you are well familiar, that we are in the process of putting a new building on the main part of our campus. And this is the Roy Blunt Health Science Innovation Center. We've been working on this for a couple of years, and one of the things that I'd like to do is just kind of explore some of the technologies that are going to be part of this building. I do need to give you a disclaimer. There's no way that I can talk about all of them. I've got limited time, right? But I've kind of handpicked a few that I would like to talk about. And as we go through, we think about healthcare education and what this can mean. So just a little bit about this center to begin with. So it is about 65,000 square feet in total. Several years ago, the state of Missouri wanted to provide funding for what was known as a transformational capital project. And so different Missouri institutions had the opportunity to think about what does that need to look like for them, for each institution. And Missouri Southern chose this Health Science Innovation Center for a number of reasons, but the number one reason really was the community need. The recognition and working with our healthcare providers and the general community as a whole, just the whole region, understanding that we need additional healthcare workers in many different roles, and also understanding that education, right, for any of those roles is going to be your foundation for healthcare in the entire region. That is a must. We're not going to get away from that. So that is where we decided to go ahead and invest in the Health Science Innovation Center. That part of it is because of that interaction with the community. So there are two portions to it. The portion that's a little lower, it's 2 stories, that is a beautiful welcome center. This is where prospective students will come. Our admissions team is going to be housed there. We can have a number of different events that are there. And then we also are going to house our global education offices there as well. And it is beautiful. I know it's not completely finished, but every time I get to go into that building, it's like another feature has been added, and it's just beautiful. The other portion is the taller portion. This is 3 stories, and this is the Health Science Innovation Center portion. So again, there are a lot of technology in this building. We have had meeting after meeting. We're down to weekly meetings, multiple meetings. Almost all of it at this point is technology focused. So again, there's lots of moving pieces for this type of center. And I can't share with you all of those things, but I do want to focus on a few things. And one of the things I want to highlight for us today is the simulation hospital. So I mentioned the entire building is about 65,000 square feet. We have over 15,000 square feet is really a simulation hospital. In the center of it is that control center or that core for simulation. So we have lots of computers in there, lots of different stations where we can have multiple simulations going on at once in various rooms. And then around that control center are various rooms where we're going to have our simulations take place. So I've listed some of the rooms for us. We have an OR, or an operating room. And as we go through these rooms, and as I say, I want you to visualize what that looks like to you. How many of you can visualize an operating room? Yeah. Or an ER, or trauma, triage type of room, sure. What about a NICU for neonatal intensive care? PICU for pediatric. We have labor, delivery, postpartum recovery, okay? We also have a couple of rooms for acute and chronic care. Those rooms can be set up as any hospital room with any type of focus, and it's changeable. So for example, if I wanted to set up a room as though we were caring for a respiratory patient, or maybe a renal patient, or maybe a patient that's had like hard tissue surgery, like orthopedics, whatever the focus is, we can set up those rooms to mimic any other type of just hospital room that we would like to do so, okay? And we have two X-ray suites, and we also have a CT suite, which is a new addition for us as a campus. We will have a CT scanner that our students will be able to learn with. So when you picture these rooms, like if you're thinking about an operating room, right? So you've got surgery lights, you've got the operating table, you have your instruments, you've got different monitors that are taking place, you've got your anesthetic machine, all of the paraphernalia. That's what this room is like. It is not a classroom, it is an operating room. And it's been outfitted with real medical equipment. The same, for example, the ER or trauma. And again, we've got the crash cart, the IV pumps, the medicine pumps, all of the things, right? The wound care, the bandaging, all of those things that you can imagine in a regular ER. That's what this room will look like. So when we say that we are going to have a simulation hospital, right, that essentially is what we do have. And simulations can take place in any of those rooms. All of those rooms are directly adjacent to that control center. So we can place, for example, the high fidelity mannequins, right, in various rooms. We can set up different scenarios, multiple simulations going on at one time. That is kind of visualize that activity, if you will. And then peripherally, we have additional rooms that you would also find in a hospital setting. So we have nurses' stations, we have debriefing rooms, and we've already mentioned how critical that aspect is to learning for debriefing. We also have exam rooms. We have clean rooms versus soiled laundry type rooms. We have a decon room if somebody's been exposed to harmful chemicals. What is the process? What is the procedure? How do you decontaminate your person? What is your protocol, the procedures? So we have rooms like that. We have medication rooms, right? And again, using equipment that you would find in a hospital setting. We also have an in-home suite. So think about the healthcare providers that are going to a home, providing care in various ways. What about our emergency personnel, our EMTs, our paramedics? So we have an in-home suite that can be set up in numerous ways so that our students have to be able to navigate a number of different situations, right, as part of the simulation. And then we also have an ambulance box, not necessarily what you would find in a hospital, but what you would find in an ambulance. And again, it mimics that. Dimensions, all of the different types of equipment, the types of medication storage, all of that is mimicked with that ambulance box. So just a little bit on why it works. Why do we choose simulation? Why does it work? Why do we know that it works? Okay. First of all, simulation these days is a standard in healthcare education, absolute standard. So anywhere from, in this country, anywhere from 80 to 90% of medical schools utilize some type of simulation to whatever degree. And closer to 90% of nursing schools in this country will utilize simulation. And other types of healthcare professionals, so I've mentioned like respiratory therapy or radiology technology or emergency personnel, they all utilize simulation in some way. And there's a number of reasons why it works and why it works so well. And we've seen increased learning outcomes. We've seen increased workforce readiness for a number of different reasons. I read a study not too long ago that before simulation became as popular as it is, if you were to survey so for example, nursing students that were new graduates that were getting ready to go out into the workforce, their level of confidence for how, what they thought they would be ready for was about 9% felt that they were actually ready, like workforce ready. So that's not acceptable, right? We need to be producing workforce ready healthcare professionals. And simulation is a huge part of that. It's a huge part of it. So one of the things that we think about with simulation, it's repeatable. It is a safe environment for our students. We're not going to harm patients, okay? So again, think about to that brain-based learning where you take fear out of the equation. It doesn't mean that you're going to take away some anxiety because that's natural, right? And especially if you have a high-stakes simulation, where you have something that's life or death, or it's more complex, and we're doing complicated procedures, and it's fast-paced, right? We're still going to have some anxiety there, but it's not going to be fear-based, and it's repeatable. So it's a safe environment. We know that promotes learning. We also think about it's the structured debriefing, and again, that is where most of the learning takes place. And I would say, even if you had, if we're going beyond simulation and we're looking at a hospital setting, you will learn in those scenarios, even if it's something new to you, but it's the reflection afterwards that cements the learning, right? That deepens it, that allows you to retain it, that allows you to really process that and internalize it to where it's not going to leave you in 6 months or a year later, and those types of things. So again, it's the debriefing, the confidence, and again, picture someone, a first-year nursing student on day one, like we've talked about, versus let's fast forward toward the end of that first semester. Can we imagine a different degree of their confidence, right, as they've worked through simulation after simulation after simulation, right? And they gain confidence, they gain the procedural skills, okay? That's critical. Because we also know, research tells us that the more confident we are in our procedures, when we do transition to the workforce, we have less patient issues. We have less issues with patient safety, for example. We can have better patient outcomes. That's a direct correlation to the health of our patients as we're looking at them, is that confidence that when you're graduating and you're getting ready to transition, you're confident in what you can do. Okay, that part is huge as well. And then I've already mentioned the patient safety and error reduction, and then the workforce preparedness. So these are just a few of the reasons why simulation works. It's a huge reason of why we've invested a new building on this campus with a simulation hospital. So I want to highlight just a few pieces, right, of the equipment that we have. And again, I can't do all of them, that's not possible, but we will be getting 9 new high-fidelity mannequins as part of the simulation hospital. And we have a wonderful sim director. She has organized these mannequins into families for, I think, easy integration. So we have 2 families, family 1 and family 2. And I know that there's a lot of writing up here. I'm not going to go through it all, but I thought you might find it interesting to read about what can they do, like what are their capabilities. What are some of the things that we're looking at? And so I'll kind of highlight some of them. So we have a male adult full body trauma patient, can bleed, right? Can have changes in pressure, sensitive wounds. We can have trauma limbs. The laryngospasms can make it very difficult to intubate. It can present a challenging situation. We can have chest movements, all of these things, right? Much more. We can have another male adult that is designed, again, lifelike cases for multiple, across the board, but multiple applications. We can have a female patient, and again, we've got lots of different things there. Some of them are very specific procedures that we can practice on. Some of these could be part of the setup in those rooms that we can design for any type of patient, right? That we have a lot of flexibility for that. A toddler patient simulator, so we're looking at pediatric care. The auscultation there means we have heart and lung sounds, for example, abdominal sounds. And then a 30-week preterm infant is in this family 1. In family 2, again, we've got different ones for different things. So what we're terming as grandpa, right, is an advanced high-fidelity mannequin. So this has AI-powered, right, AI-powered speech. This mannequin can interact with you, can answer your questions, for example, in a reasonable way. Can do things like sweat, have different robotic movements, can have eye tracking, again, the facial expressions. I will tell you that I've seen some people say, oh, that's kind of creepy. Maybe, maybe, but it's really critical, and especially when you're looking at very specific simulations. We have a female for labor and delivery. And again, lots of differences on the spectrum there, from normal labor and delivery to more complicated cases as well. We have another pediatric, a 5-year-old patient simulator. And this one, I've actually got to experience. We have this one on loan for a while, and it is amazing. Just the ability to have that mannequin track your movements with their eyes like a patient really would. And again, the different facial expressions, the ability to see them sweat, for example, or maybe some skin color changes, like someone turning blue, for example. Those types of things. It is sophisticated technology. And then a newborn simulator as well. And again, these are high fidelity, so they are as real life, right? They're going to mimic real life as much as possible. And I would consider these to be state of the art. I think I would put these mannequins up against any mannequins that are out there. So we're super excited about this type of technology. And I wanted to mention a few other simulation technology. So I mentioned a little bit about the AI. So it's artificial intelligence. It's going to power or have at least a component of some of these high fidelity simulators that are here. That's critical. They can respond to what the student does. So again, that's AI-powered response to if the student decided to say something or to do a procedure or an action, then we have a mannequin that can respond to that in an appropriate way, or whatever way that we want to from the control room, right? Like we can kind of guide and control that as we go through as well. And there's some advantages to that. If we have AI as a component in these mannequins, that may take away so much of a need for hands-on instructor or a facilitator in the control room, especially if we have multiple simulations going on at once. So there are some advantages to those. I've mentioned the high fidelity simulators that we have. I also want to mention the haptic feedback. So that haptic component means that we get the dimension of touch. And so, for example, if you are placing an IV catheter, you will be able to sense if there is resistance there, just like you would with a living patient. If that patient has tensed their muscles, or maybe we've encountered some scar tissue, or whatever the case may be, it is being able to have that added degree, that dimension of touch within some of these mannequins that we have, which is phenomenal. VR is a type of simulation, virtual reality. We can also have augmented reality and extended reality. The virtual reality, and I've got a couple of pictorials that are here, usually we're dealing with some headsets, some OcuSets, maybe some controllers. That's what that looks like to like a passerby, right? We've just got somebody that's wearing this technology and we can't really see what's going on. And they might be making some really rather odd movements because, again, they're doing something very specific. A passerby is not going to see that. So these pictures show, for example, like what that student is actually seeing, like what they're actually doing, whatever procedure it is. That's virtual reality. The augmented reality, we get into things like we can overlay with real clinical data that's changing, match it with patient data. Or we might be able to, in the bottom one, we're using that data to show some of the patient record, the patient images, for example. That's what they're seeing. That's virtual reality. That's another type of simulation that allows them to, again, in a safe environment, practice things, work through scenarios. That's another way that we can learn, right, with simulation. And then I also wanted to mention SimX. So this is a virtual platform. And it's programmed. It has over 250 pre-built sessions that are there. Vicky's looking at me, so I'm gonna move quickly. I think I'm going to. 5 minutes. I've got 5 minutes. Okay, I'm gonna move very quickly. I'm going to back up just for one thing. I'm gonna skip some of that, but I do want to mention this one. Last but not least, we have another center that's part of the Roy Blunt Health Sciences Innovation Center, and this is a 3D center that is for precision health. It's like 3D medical printing, if you want to think of it that way. Lots and lots of applications here. I'll just mention a few of them because we are going to be short on time. But what this can do, so many different things. We could take a patient image, like a CT image, for example, and we can print that with a 3D printer. And we can print it in a very lifelike way. So whether it's like a bony matrix or soft tissue type of matrix or blend, we can print that in a lifelike way that can be used for patient education. So a physician could show their patient, this is your anatomy, this is what we're dealing with, this is why we're going to have to do this surgery or this treatment. We can use it for education for our students. We've printed 3D images of our cadaver hearts that we have. We CT scan, print those, so we can capture different diseases in perpetuity. That's huge. We can use this for surgical planning. So for example, and I'll skip to this slide, this is a patient replica of part of the pelvic bone. And you'll notice some red splotches that are there and some plastic pieces. So the patient anatomy is printed by 3D technology. And what we used this for was to make surgical guides that could be used to give that physician time to practice, like the exact angle of what we're going to do, because these red splotches indicate cancer of that bone that's going to have to be surgically removed. And so the guides were printed by 3D, right? That's part of surgical planning. Now, this is on loan to us from Children's Hospital in Nebraska. They use 3D technology every day in that hospital, and that is part of what we're going to have in our facility as well. So lots of applications there. And one thing I wanted to do, I'll kind of skip over some of this. I want time for the video. Do I have time for the video? Yes. Okay. Go for it. Okay, I will. I thought it would be nice. This video, and I want to thank our URM team for putting it together, is just kind of an overview of the Roy Blunt Health Sciences Innovation Center. So I'm going to leave you with that. Let me go ahead and show.
Our great achievements start with a clear vision. Create a state-of-the-art simulation hospital that advances health science education and meets our community's critical healthcare needs. Powered by a generous $2 million federal investment and a matching $2 million commitment from the state of Missouri, our vision has united Jasper County, the city of Joplin, and more than 70 donors to propel a transformative $48 million project that will redefine the future of healthcare education. On April 11, 2024, we broke ground on the Roy Blunt Health Science Innovation Center. Today, the project continues to take shape as interior work reaches important milestones. This facility reflects Missouri Southern's expanded statewide mission. Inside, students will train in spaces that will allow them to explore boldly. These include a simulation hospital featuring acute and emergency care, labor and delivery, NICU, and a model ambulance. Expanded laboratories for research and dissection, a radiologic technology lab with CT, ultrasound, and X-ray suites, and a virtual reality clinic for immersive learning. Here, students gain the skills and confidence to care deeply for patients in real-world scenarios. This building is about impact. Many of our graduates choose to live and work in MSSU's surrounding communities, becoming the healthcare providers who care for our family and neighbors. By investing in this center, we're investing in the health and vitality of our entire region. The Roy Blunt Health Science Innovation Center, where innovation meets compassion and the future of healthcare begins.
Thank you all. I appreciate that. Okay, I can do one or two? Is that what I'm hearing? I can do one or two? We'll see? Okay. Do the simulations include dealing with aggressive and violent patients? They could. They could. And actually, isn't that an important part of developing the skills for any healthcare worker? Now, so for example, I mentioned using standard patients, which are actually actors, right? And so with something like that, we could certainly do a simulation that involved that. Now, the safety of our students has to be utmost, but we also have to equip them with the skills that they're going to need when they come into a scenario like that in their job. That is part of the preparedness that we have to do. Oh, when can the public tour the new building? Not quite yet, not quite yet. I'm not sure if we have a date of occupancy just yet. They're still doing a lot of things. A lot of it is finished. We're in the process of moving in a lot of equipment. The X-ray units went in. I think the CT unit is in. We're working on other small things now. And there are some actual construction items that are still taking place. So I'm going to say soon, but I'm not sure when. Okay, maybe, yeah. I know we have lunch. Thank you all. Thank you very much.